In recent years, we've seen important improvements in managing patients with atrial fibrillation, but because of changing lifestyles and an older age population, we may not know as much about the incidence and also the risk factors for AF that we think we know. So it's a perfect time to look at the September 1st issue of JACC, and there is a paper there that is taking a look at incidence of atrial fibrillation and relation with cardiovascular events, heart failure, and mortality. It is a community-based study from the Netherlands. So I would like to introduce you to Dr. Isabelle C Van Gelder, MD, PhD, from the Department of Cardiology, University Medical Center at the University of Groningen in the Netherlands, northern Netherlands. Why did you do this study? Like I said, things have changed a little. Is that what you were looking for?
Well, things have changed, and what we know now comes from especially American studies, American epidemiological studies, the Framing a Heart study, of course, and these are rather old studies. So we had the opportunity, actually this study was started by our nephrology department, but already then we worked together, so they have their EKGs. And so we had the possibility and the opportunity to look at the incidence of atrial fibrillation. Actually, more than 8,000 people were included in the trial back in 1997. And we now have a follow-up of almost 10 years when we did this analysis. And what we did with these men and women, no patients at that moment, we saw them every 3 years at our department and other hospitals nearby. It was performed only in the northern part of the Netherlands. And those people who live over there do not move. So we have a very good follow-up.
Very nice. So you're looking for what has changed. I mean, we think we know what the risk factors are over the course of, like you say, from the data. What are we learning now?
Well, what we learned now is that obesity is a very important risk factor. 5 points in BMI elevation means a 50% increase in the risk of atrial fibrillation. And that's what we see.
So if you go from 25 to 30...
then your risk is almost increased by 50%, 45% actually. And that's also what we know right now. And when we also look at the same issue, I think also the September 1st issue, all that famous work from Press Sanders, who shows that if you reduce weight and you perform a little bit of physical activity, then the AF burden reduces. And I think that's what we learn, and that's also nice that the JACC publishes both studies, because they are a little bit linked. Obesity is an important risk factor next to advanced age, still male gender, prior myocardial infarction, prior stroke, and hypertension, of course. So that are the well-known old risk factors. And what we now learn is that obesity is a very important risk factor.
And you're from the Netherlands. You talked about bicycling, right? You do it yourself. You could teach us a lot about how to take care of ourselves a little bit better.
Well, Netherlands is very small, and I only live 10 kilometers from my hospital, so I have the opportunity to bike. And a lot of people in the Netherlands do, but we all know that our lifestyle has changed, and it is very difficult to become not obese. Everybody knows. Sure. And when I'm in my outpatient clinic, then a lot of people who are sitting in front of me and coming because of atrial fibrillation are obese.
What else did you learn? Did you find any other connections or no connections where you thought there might be?
Well, actually, after multivariate analysis, BMP was a predictor, but not anymore after multivariate analysis. Wow. I think that's also of importance, that it are easy to find risk factors. And last year we also published another paper. It was a white paper also in JACC, and that is, we believe, and we did that together with other AF researchers like George Weiss and Stan Littell. We showed, and we had arguments that atrial fibrillation almost never comes alone. So lone atrial fibrillation doesn't exist. So obesity is an important risk factor, but probably OSAS and other things we do not yet know, and genetics play a role. So a next community-based study on the incidence of atrial fibrillation will learn even more probably. But obesity now, like hypertension, and of course the advancing age, but what we also see is that more and more men and women develop atrial fibrillation at a younger age. The mean age of our population with atrial fibrillation was below 50. So that is rather low. And it was also a young population we assessed the incidence of atrial fibrillation in.
It was 1 year ago at ESC when we talked with one of your co-authors, in fact, about that paper in JACC on there is no such thing as lone AF anymore.
Yeah.
And I thought that was a very good paper. So we'll put the citation up for that too so that everybody can go back to it because that was a good one.
Yeah.
So obesity has become a major risk factor for AF. And incident AF doubles the cardiovascular event risk, all-cause mortality risk, and heart failure risk fivefold.
Fivefold, and I think that's also important. So when atrial fibrillation occurs, then the risk for stroke, for heart failure, and for mortality significantly increases. Wow. And we know about stroke very well, but still mortality in that population, relatively young population, was doubled. So I think we have to take care in our strategies more and more. We have to learn more about pathophysiological mechanisms so that we in the end can...
I mean, obesity is going to increase. We are going to get any younger for a while. The population is going to continue to age.
It's an epidemic. Yeah.
So we really need to concentrate on AF, and if we can prevent it, it's important.
We can prevent it, but we can try. And if you read the Paris Sanders paper, then by lifestyle and by risk factor management, we can reduce the AF burden and also reduce the cost for atrial fibrillation. And I think also in our what we now learn more and more is about heart failure with a preserved ejection fraction. All the data are about heart failure with a reduced ejection fraction. And even in our population, the incidence of HFrEF with a reduced ejection fraction was higher than HFpEF. That's because we cannot, to make the diagnosis of HFpEF is very difficult, but we know everybody knows the patients with atrial fibrillation who deteriorate once they have an episode of atrial fibrillation. That are typical HFpEF patients. And that's also for the future we have to learn, because also that may the incidence of HFpEF will increase.
Oh yeah, absolutely.
And I think also the link between atrial fibrillation and HFpEF is important to discover.
Well, I think the point you're making here in this paper seems to be that we've got all these risk factors for incident AF, so prevention of AF and HF and all of this, it's kind of multi-pronged.
Yeah.
If you can prevent one of them, it can help you prevent others too.
Right.
And I think that's a great message. And thank you for updating the data, because it's a little old, so now we know a little bit more from the Netherlands. Thank you very much. And this is in the September 1st issue of JACC. Please check out the data there and on CardioSource World News, where I'm Executive Editor Rick McGuire.